Hello guys, and welcome to this video to discuss about overhangs. Okay, so what to do and how to detect the problems with overhangs of restorations. If you guys go back to the video of class 2, first you guys will understand that if you don't use the wedge and the matrix properly, then of course you are going to have problems, and it's likely that you are going to have overhangs of your restoration. So that's how to prevent, of course. But once you have the overhangs, or once your patient comes with overhangs of restorations, you guys need to detect and you guys need to take action during the treatment planning, and then this needs to be solved. Let's discuss how we should do those things. So let's discuss this case now. This top left corner image here is the same case of the bottom images. Okay, so we are going to, it's actually the same case, but the upper right radiograph is actually a different region, of course. So this is the upper right quadrant of the patient, and then we have this tooth here with this molar with two extremities of the restoration. Okay, so two class 2 restorations, if we can consider like this. So this side that you are seeing below here on the bottom left corner of the screen is the mesial side, this side here, okay, so the mesial side, where we have recurrent caries. This is the caries on the radiographs, and when we see the clinical situation of the tooth after extracted, because there was furcation involvement, there was other conditions, and then that's why the extraction was the treatment plan here. But when we see the extracted tooth, then take a look at this. There are shadows. So let me even give a zoom here for you guys to see. All right, so this is the radiographic image, radiolucent image suggestive of recurrent caries, of course. Okay, maybe even due to the lack of adaptation here. But then when we see the same surface, then take a look at this. We have the restoration. There is the small overhang here. But then there are shadows, you see, there are shadows on the dentin, which doesn't happen on the other side. Take a look at this. So this is the mesial side of the tooth, okay? And this is the distal side of the tooth, right? So this is the mesial side, and we have those shadows here and everything. And this is the distal side, which is this one radiographically, right? So now you guys have, let me remove here, and now you guys have this clinical aspect of this side here, okay? And then, although we do have also a small overhang here on this side, then we don't have recurrent caries, at least, right? And that's why we are seeing this situation on the clinical aspect of the tooth, okay? So this is actually this, all right? Without recurrent caries. And this one here, of course, is this one here, okay? We have, those are the two same surfaces. That's the mesial surface of this molar. And then we can even confirm because of this radiograph, because the palatal root is aligned with the distal, with the mesial root in this case, and then that's the recurrent caries, and this is the surface closer to the palatal root, of course, okay? So as you guys can see here in this case. Well, so we need to detect that, and then we need to do something. We need to replace this restoration, and then take a look at this. Can we restore again, or this will be below the gingival tissue? If this is below the gingival tissue, you guys can use electrocautery and something like this, and then you can still try to be conservative and do the restoration. But if it's on the level of the alveolar crest, then there's no solution, only extraction, like the other region of that we have here on the other radiograph on the top right corner of your screen, okay? So take a look at this. Let's increase now the size of this other radiograph. And now the overhangs are even in continuation with the alveolar crest, so with the level of the bone, okay? So that's the level of the bone. And now the restoration is even in continuation, we say like that radiographically, with the bone, with the restoration. Okay, now of course we have recurrent caries here, even opacification of the maxillary sinus, And then we can even see the nutrient canals here. So this radiolucent line here is the nutrient canals of the sinus. And then also this situation of the premolar, where we can find a radiolucent lesion with ill-defined limits, and that's a radiographic abscess, periapical abscess, okay? So not yet a granuloma, because we have ill-defined limits, and that's an acute alteration of the bone, not yet chronic as periapical granuloma will be. All right, so here in this case, extraction of both teeth, we cannot do anything else, because you are never going to be able to restore those areas now, not only below the gingival tissue, but also very close to the alveolar crest, even below the level of the alveolar crest in some areas, so we cannot just restore that. Okay, so unfortunately that's the problem. That's why we are even having radiolucent alterations here of the second molar as well, periodontal ligament space widening on the palatal root of this tooth, okay, and that's it. So that's why we need to do that. Now, in cases where we do need to extract, please take a look at this recommended reference, where we can have a method we described several years ago, so many years ago, using a multidirectional handpiece, and it's a method described to try to remove the overhangs of restorations and even finish and polish restorations and preparation margins. Okay, so in the literature you could find some solutions. If you have direct access to the mesial and distal surfaces, then you could of course try to polish. Okay, so but in cases like this, for example, then of course not. Then it's already beyond the level of the alveolar crest, beyond the level of the bone. Okay, even here on this other on the first radiograph, we have some overhangs here, but okay, so we don't have caries, right? So we don't have recurrent caries yet. At least that's what the image suggests. But we do have horizontal bone loss due to the edentulous site. Okay, so lack of mechanical stimulation, and then we have the bone loss here, which can even compromise implant placement, for example. All right, so if you guys like, please hit the like button, don't forget to subscribe, and see you guys in the next videos.